Good morning, good afternoon, good evening, wherever you are. This is Professor M Explains. Once again, we're going to a topic regarding the physical therapist or physical therapist assistance in testing. We're going to talk about the NPTE today. So we're going to talk about some layouts, some questions, we're going to get a little bit into the psychometrics and kind of the functional design of the test. We'll get into test taking strategies later, but for mainly this part is just going to be talking about the test itself. So what is the NPTE? The NPTE is the exam taken by both physical therapists and physical therapist assistants, so PTs and PTAs, to assess them for entry-level clinician performance and competence. It's written by volunteers who are currently both practitioners and educators in the physical therapy field. The focus is on several key areas of concern for entry-level clinicians, with a strong focus on client safety and public protection. It doesn't specifically test for areas of expertise, so it's not going to ask specific questions about vestibular, pediatrics, pelvic floor health, but there will be generalized knowledge questions about those areas. The questions are written as a standardized multiple choice question with one most correct answer per choice out of the 4 possible choices. The test is then normalized in content for those questions as specific to the PT or the PTA. Textbooks, content, questions, and all relevant associated skills are assessed on a regular basis by the FSBPT to ensure that content is still relevant to current practical patient care. So what's it make up, right? What does it look like? Well, for the PT, the 2022-23 standards, which are now the outdated standards, had 250 questions, 200 of those scored, 50 pre-test or practice questions. We'll talk about those later. Most of those test questions are text only with very minimal graphic style questions that do come in occasionally. There are also a few, very few, video related questions that are present. With the updated standards, there are 225 of those questions, so it did reduce slightly. 180 are scored, 45 are pre-test. Most of those test questions are text only, but now there are more graphic style questions and more video related questions. Most of the videos are less than 15 seconds long. Also now, though, there will be 40 or up to 40 scenario-based or vignette-style questions. These questions are not nested, though, so there may be multiple questions associated with one vignette, but that doesn't mean if you miss question 50 that you're going to miss 51, 52, 53. It just means that those questions are going to be related to that specific patient case scenario or vignette. For the PTA, it's very similar. It's just there are 200 questions on that test, 150 scored, 50 pre-tests in the 2023 standards. 2024, again, it reduces slightly. We're now down to 180 questions, 40 questions scored, 40 questions pre-test. Most of the test questions, again, are based on the PTA's version of care versus the PT's. So there's going to be no questions about evaluating clients and things like that on the PTA standards. In the sections, for the PT, there were 5 sections broken down into 50 questions per section. Now there are 5 sections broken down into 45 questions per section. For the PTA, it was 4 by 50. It is now 4 by 45. So what are these new scenario-based or vignette questions? These are new questions that provide a chance to be provided a patient case study, review it, and answer questions based upon that presentation of the patient. These new questions represent what you're actually going to see in the field, right, as a new clinician, and gives you a chance as a test taker to really show your skills as an entry-level clinician. These new questions also test your ability to manage those patient case studies, break down the vignettes, identify relevant or irrelevant information, and demonstrate your real, good, sound clinical decision-making. So it's comprised of these sections and content areas that are specific to both PTs and PTAs. Obviously, both PTs and PTAs are going to have very similar body system areas. The questions are just going to be slightly different, with the PT having more high-level questions on these regarding evaluation and maybe the presentation of patients with multiple comorbidities. So we have cardiovascular systems, musculoskeletal systems, neuromuscular, integumentary or skin, metabolic and endocrine, GI, gastrointestinal, genitourinary, including pelvic floor health, lymphatics, and then the interactions between all of those systems combined. There's also been non-system section questions. We're talking about equipment, devices, and technology. Now, the PT is going to have obviously less than those of the PTA in that section. Therapeutic modalities, same idea here for the PT. safety and precautions, professional responsibilities, and then also research and evidence-based practice. As you can see, for the PTA, systems are exactly the same. So everything matches, it's just the number of questions per section are going to be different based upon your skill and educational level. So question can be broken down in both being a physical therapy data collection question and follow the neuromuscular system question. So they can cross over those questions. Those questions are going to be broken down by level of question or skill level of that question. So there's going to be level 1, level 2, and level 3 questions. Level 1 are going to be basic foundational questions. These are core questions. Quick recall, least amount of points. So these are going to be questions like, what is the origin of the biceps brachii? Level 2 is going to require some synthesis. So it's going to require you an integration and application of your knowledge. These are the second most highest level of points. So these are going to take that level of questioning, instead of just asking you what is the origin of the brachioradialis or the brachialis or the biceps brachii, and maybe then apply how do those muscles interact together and what is the presentation going to be like if a patient has damage to something like musculocutaneous. The level 3 questions are going to be your interpretation questions. These are going to apply an appropriate integration, knowledge, and implementation of treatment. These are the highest level points. So these are going to be questions that take all of those previous levels, and now you have a patient presenting like X, Y, or Z. How do you handle them? What do you do, right? There's going to be a blend of all of those questions, and the scoring system is then going to go from a 450 level scale to an 800 scale, with a passing score of being 600. The average percentage of questions in the correct last exam to get a 600 score was 67.4, or 122 correct for the PT NPTE, and 95 correct for the PTA NPTE. Note, one question or one person may only require 122 out of 180 to pass, while another person may require 118 out of 180 or 126 out of 180. It's going to be based upon a standardized level of the questions they're getting. So if you get more level 1 questions, you're going to need to get higher levels of passing, right? But that also means you're getting a little bit higher level of easy questions. But if you get more level 3s, you may require less. So it's going to be based upon those question difficulty levels. And please note, just because somebody gets an 800 out of 800, it doesn't mean they answered all the questions correctly. It just means they received a top-notch score based upon the questions they were given. Tests are also broken down in a couple questions and in a couple parts, and your national exam will be the same, right? You're going to have the item. That is the whole multiple choice question, right? So it is going to be this whole long question working out there. In that whole item, there will be a stem. That is the part of the multiple choice question that asks you the question. You have to know where that is. You have to identify that. What is this question actually asking me? It could be a long, drawn-out question about something about wheelchairs, right? But it may be something related to specifically propulsion of wheelchairs. So you have to break that out of that question. That's the stem. And then there are going to be options, and the options are your answers. There are going to be 4 of those per multiple choice question. There's going to be 1 most correct answer, and then there are going to be 3 other answers that are often distractors. Those are the ones that you're going to look at and go, you know what, A looks right, but man, B, they're designed specifically that way. It is not to trick you, but it is to make you pick the most correct answer out of all of the questions. Remember, the NPTE, it's not always the most aggressive or the newest technique or the newest treatment you saw in your clinic. It is based upon the safest treatment for that patient. If it includes something like a gait belt, probably the right answer. If there are questions about assistive devices, look for the least restrictive assistive device for motion or the safest device when it comes to safety. Those are probably the right answer. If you see something like stand them up, check the catheter, that's probably the right answer because it probably is going to have something to do with autonomic dysreflexia. So you're looking in those questions, and those are the things you're looking for. You're looking for, in those items, finding my stem. Once I find my stem, then I got to go down to my options and pick the best option that regulates back to that stem, right? Always make sure you're kind of making sure those 2 things fit together when you're answering the question. With questions, you can mark questions, right? You can mark them for a review, but which one should you mark for a review, right? Your best option here is to divide these questions into a couple categories. Questions that you already know the answer to. Don't mark these. All you're doing is taking up time, right? Answer those questions and move on. If you know the origin of your triceps surae muscles, Don't mark those. Answer it, move on to the next question. Don't take time out of your valuable time that you have to take this test going back and reviewing questions that you already knew the answers to. If you have questions that you're confident that you got the right answer to, don't mark these either. Your gut's usually right, and don't go back and review them. If you go back and review them, you're probably going to change the answer, and you're probably most likely going to change the answer to an incorrect answer. Then you have questions that you don't have the foggiest clue on Mars about, right? Those are the questions you want to mark, right? Mark them, move on, come back to them. Don't spend a ton of time dwelling on those questions. Mark it, move on. This prevents you from getting stuck on that question, and it prevents question number 50 from affecting questions 51, 52, 53 because you're now focused on, oh God, I can't remember what that question answer is. The more questions you mark, the more time you'll spend on going over them. So you shouldn't be marking 50 out of your 50 questions, right? Ideally, in each section, you kind of want to keep it to under 10 questions. That would be the most ideal situation. If you can have none marked, that'd be even better. So the question I often hear is, well, if there's divided equal components, but what about those questions that are those practice sample questions? How do they affect your scoring? Well, here's the good news. Those practice example questions don't affect your scoring. Those are there to help us prepare for the next level of the NPTE, right? But it will not tell you which are scored and which are non-scored, which is bad. That does affect the clinician's morale when you're going through and taking this test. You want to think of those as potential future tests, full-time test questions. They're testing them out. They're kind of giving you guys a chance to preview these questions that'll be on future NPTEs. They're also used to judge knowledge of the newest information, newest diseases. An example of today's day and age might be a question regarding long-term COVID outcomes, or maybe something like PASC. It's looking at what we're going to have to deal with in the future, maybe not right now. During your test, there'll be a scheduled 15-minute break. Take it. Don't skip your break. Get out of your chair, go to the bathroom, splash some cold water on your face, right? If you skip the break, you're going to fry your brain, so don't skip it. You can also take a break at any time during the test other than scheduled break, but you will lose testing time. So if you're in the middle of section 1 and suddenly your bladder screams out, I've got to go to the bathroom, you can do that. But understand it's going to take away from your time for section 1. Also be aware that you may be searched going in and out of the testing room. So if you have to get up and use the restroom, take that time into account, because before you go back in, they're going to have to make sure you didn't grab something in the bathroom and put it in your pocket or something to that effect. There are several types of mistakes people make when taking exams, right? And they can usually be divided up into a few categories: knowledge-based, choice-based, test-taking based, right? So a knowledge-based question is, yeah, I guessed, had no clue, didn't study it enough, right? I didn't know what the origin, again, of the vastus lateralis is. You should know that. But if you didn't, and that was a true knowledge-based question, that's something you need to go back and review. Choice-based. I knew the answer, I had the knowledge, but I picked the wrong one out of the two choices, right? I chose the wrong answer. I didn't read the question thoroughly enough and equal enough to actually get the right answer. Those are usually the ones when you go back and review it, you're like, oh, why did I pick that one? I knew it was A, why did I pick B? And you look at B and like, okay, B was kind of solid, but those are choice-based errors. Test-taking based errors are the worst you can make. This is where you make up an error on your choices. These are typically when you're taking a paper test that you circled B on your paper, but filled in C on the Scantron. But you really meant B, but you filled in C, right? You totally did not read the question despite my exceptional knowledge, right? So you didn't see those nots, most, likely, before, except, right? Any of those big bolded words that are going to kind of quantify and qualify that question. Pay attention for bold, underline, capital letter words. Those are going to be really key, right? Or, you changed your answer after your gut said A is the right answer, and you just absolutely changed it. Your mission here, should you choose to accept it, is to, when you're taking your practice exams, review them. Look at the questions you got incorrect and decide whether you made knowledge-based, choice-based, or test-taking based errors. Obviously, minimizing these errors is the goal, but this can be telling when reviewing an exam. It can help you prepare for future exams. Obviously, out of all of those, you truly want to minimize that test-taking based error, because if you can minimize those and get those down to a naught or just about close to naught, that can really help your overall scoring on the testing. So as you take more test and preparation, you should be seeing less of those test taking errors, right? Ideally, you want to see them all go down to 0, right? But that'll never truly happen. You're always going to have 1 or 2 questions that you kind of mess up. This is a great little card that I created here that helps you kind of gauge where you are in pre-test and test questions. When I post the PowerPoint, I'll have this up there for you if you want to print it out. And every time that you do a practice exam, go back and review all of your questions. At that point, you're not reviewing the test. Don't go back and review and look for answers and stuff like that. Just go back and go, okay, yeah, this is a knowledge-based. Okay, yeah, this is a choice-based. Okay, oh, God, I screwed this one up. It should have been B. Mark those down. And what you should see over time is those test-taking errors go down, right? Hopefully your knowledge-based errors go down as well, but definitely want to minimize those test-taking based errors. Some test-taking strategies: trust your gut, it's probably right. Don't change your answer unless you absolutely know you made a test-taking mistake, right? If you're looking at it and A is the answer and for some reason you click B, that's the time you change it. But if you're looking at it and going, oh, you know, my stomach says A, but C, right? Don't make that mistake. Your gut is usually right. Focus on answering those questions quickly and move on decisively. You want to read the question, find your stem, pick the right answer, move on. Don't dwell, right? Look, yes, questions 4 hard, but if you spend that time thinking about question 4 the next 7 questions, you're likely to at least get 50% of those next questions wrong as test-taking mistakes. Mark it, complete, move on. Remember, there's no penalty for guessing, but not answering a question could very, very much cause you a penalty. The exam is the exact same in every state in the United States of America, meaning if you take it in Alaska, it'll be the same as taking it in Washington, D.C. There is no easier way to take this test. The test is not more or less difficult during times of the year. I've heard this before where somebody will say, well, in January it's easiest, and in July it's one of the hardest tests you can get, and then the end of the year it's kind of between the two. That's not true. The tests are the tests are the tests. It doesn't change difficulty. The other thing I hear a lot is there are multiple correct answers. No, there are not multiple correct answers. There are multiple distractors in the other answers, but there is only one correct answer for every question. It is the most correct. It is the one that is going to get you the scoring. The test is highly correlative on what every entry-level clinician needs, right? The FSBPT really does keep a pulse on practice of the country, right? Your educational background, whether you have master's, bachelor's degrees, and other items, has nothing to do with your grading, right? It doesn't matter if you were necessarily, you've got a degree in kinesiology or you've got a degree in test taking or something like that. What is kind of the key thing here is it is based on the education or prerequisite you need to get the degree of your level of the test. So a PT test is going to be harder than a PTA test. That just makes sense. It's a doctorate level test versus an associate's level test. But there's not going to be specific differences there where, oh, well, because John's got a bachelor's in kinesiology, he has a leg up on somebody else. The only thing John might have a leg up on is he may know the specific parts of systems and stuff better. But that's not a degree-based problem. That's a knowledge-based. He's actually more well-read and more understanding of it. One of the key things I tell a lot of students that I proctor and kind of help through this is anatomy is key. There is a high correlation to your anatomy grade going through your program and your score on the national exam. Well, why is it? Our entire practice is built on anatomy. You need to know your nerves. You need to know your muscles. You need to know your actions, origins, insertions, innervations, and nerve roots. If you know a lot of that, a lot of these questions can be broken down into those simple anatomy kind of concepts. You may be applying the concept on a level 3 question, but it can be broken down to that level. So it's really important that you have a good, solid foundation. And once you have that solid foundation, then you can build your house on it. But if that foundation is not solid, you're going to struggle, right? The other thing is, if you get a 599, that means you failed, right? There's no ifs, ands, or buts about that, unfortunately. it really, really sucks if you're that person that gets 599, right? Especially if you get multiple 597, 598, right? You want to make sure that you get that 600, that passing score. And then once you pass the test, it really doesn't matter. I've never had anyone ask me, hey, what did you score on the NPTE? Right? The only time I've ever had somebody ask me that is when I've been tutoring them or proctoring them. So in reality, there's a old adage that says, what do you call somebody who graduates last in med school? You call them doctor. Same idea here. If you get a 600, great, you passed. You get a 599, you failed. You get a 750, 800, you still passed. You've gotten your license. That's the important thing. This is to make sure that you get your entry-level clinician license. There are plenty of other strategies and things we can work on in the coming future, but these are the basics on the NPTE. If you have any questions, please go ahead and leave them down in the comments section for me. I look forward to all of them. In the community tab, there is now a section asking what you might want reviewed in future videos. Please go ahead and post it there. Make sure you do like, comment, subscribe, turn the notification on so you know when I post videos like this, and also share these with your friends. Please, I'm trying to grow this to help more and more students out there. I'm not doing this. This is, no one's paying me to do this channel. This is completely of my own free will. And obviously, I look forward to working with you guys all in the future. Remember, study like you would practice for any sport or any other skill or playing the piano or whatever you're doing. The more you study, the more you focus, the more you prepare, the better your outcome will be. Thank you for watching. Again, this is Professor M. I look forward to seeing the next video. Until then, have a great one.